Welcome to the Totally Adequate podcast, produced by Quest Analytics. Here, we dive into the latest news, policies, and innovations in healthcare provider network management with industry leaders who are shaping the future of care. Our mission? To elevate community health across the nation through superior provider networks.
Hello and welcome to the Totally Adequate podcast. I'm April Bean, your host, and today I'm going to take you to a conversation I recently had with two leaders from Quest Analytics, our CEO, Steve Levin, as well as Scott Westover, our Chief Network Solutions Officer. Both of them, from their past experience and where they sit today at Quest Analytics, bring a very unique perspective to the conversation regarding the regulatory and market trends of 2025 and how that change in regulatory focus is impacting how you're going to do your network strategy, not just in 2026, but 3-5 years from now. As part of this conversation, we looked into several topics, including understanding the most significant regulatory and market trends of 2025, which I just mentioned. We want to learn how data integrity is now the foundation of not just compliance, but also innovation. You're really going to want to tune in for that conversation because they talk about how 100% data accuracy is not attainable, and we tell you why. And we also talk about how the context of the accuracy of your data is very important. In addition, we look at insights into the changing government perspective on consumer-facing data. And of course, we'd be remiss if we didn't throw a little bit of AI in there. So thanks for tuning in, and let's go to the conversation. Steve, Scott, welcome to the program. I do want to give each of you just a minute to introduce yourselves and share a little bit about your background. Steve, will you go first?
Sure. Thanks, April. Good afternoon, everybody. Time zone dependent. Steve Levin here. I like to describe myself as a reformed consultant. I was 18 or 20 years doing corporate strategy and M&A in and around healthcare and technology, and then I set up and kind of made the big leap, founded a data analytics company for rev cycle on the provider facing side. And I worked on that business for a dozen or so years. And sort of my journey took me from consulting to the provider side. We were then bought by a clearinghouse. I spent some time in the middle of the ecosystem, and then left that, and I joined Quest now, coming on 5.5 years or so. So now here at Quest, we sort of live in this sort of center cornerstone position with payers, providers, regulators. So over that sort of much longer career than I'd like to admit, I've sort of seen all the parties and sort of the data and how data is flowing. So it's exciting. Scott, I guess you're up next.
Yeah, thanks, Steve. And I joined shortly after you. I've been with Quest Analytics for about 5 years now. Currently in my role, I spend a lot of time working with our state and federal regulators, working on all things related to provider networks, provider data, provider access. Prior to joining Quest, I spent some time, not unlike you, Steve, in the environment itself, where I was a market president for a Medicaid managed care organization. Also spent some time with a large national in the national account space as a network expert. And prior to that experience on the health plan side, worked in the provider space as an administrator for a community health system, as well as an academic medical center. And I think being here at Quest, it's a unique opportunity to put all of that experience together and now talk about provider access and provider data.
Fantastic. Well, leveraging that experience and your unique perspective, as we said, we're going to be talking about a lot of content here today. Like I said, first, we're going to take a look back at 2025. I think it's always good to look back before we look forward. So we're going to look at those market and regulatory trends. We're going to talk about why data integrity is so imperative as we look toward the future. The evolving government conversation. Scott, I know you have a lot to share in that regard for us. We'd be remiss if we didn't talk about technology, AI, and the path forward, but I think everyone's gonna be a little surprised on the conversation where we're headed for that today. And then we'll talk about competitive insights and best practices. What our callers, our listeners here today can really do as they're looking to make those strategic decisions in the future. And then we'll open it up for some Q&A to everyone who's on the call here today. Sound good, gentlemen?
Sounds great.
Let's go.
All right, awesome. Well, Steve, I'm going to start with you. Like I said, let's look back before we look forward. What were some of the most impactful trends, regulatory market shifts that occurred this year, and how are they affecting health plans' network strategies?
Well, I think 2025 will be a year that people are happy to leave as it relates to healthcare, health insurance, and sort of the kind of whole market context. This has been, following the public health emergency, and I think sort of a very kind of a localized 3-year period where a lot of money was put into the system, a lot of rules were relieved, we accelerated a bunch of things trying to make sure that so the economy, the population, was sort of stabilized, if not supported in times of great uncertainty. The last 12 to 24 months have been sort of a return to a more normal context, and that's been painful. I think, April, you have the slide. Can we go to the slide? This is some work that was done by Evercore, and it just looks at the operating margins by the different plan types over the last couple of years. This industry, healthcare, I'm going to say that, so insurance, providers, members, it's under great stress right now. This chart shows operating margins for 3 different cohorts, so the nationals, the blues, and the regionals. And one of the most striking things here is that since 2021 or 2022, the blues and the regionals have been sort of around the zero line, not making a lot of money, but also not losing a lot of money. And you can just see all those lines take a turn in 24 and into 25. Margins the operating reality for health insurers is really tough. Utilization is up. The public health emergency, sort of deferred care. We've seen the last couple of years to continuing what's been a long cycle trend of provider consolidation and aggregations of health systems getting bigger, doctors getting into larger groups. That's had sort of two phenomena. One is it gives them sort of leverage in their supply chain, like how they buy, but it also is very much a part of sort of their ability to control their kind of get more leverage in their rate and reimbursements, and so the kind of contracting with the insurance companies. And so we're seeing, as the margins have gotten tighter, as utilization's gone up, providers are starting to ask for more reimbursement because their costs have gone up. And like this whole industry is in sort of a real moment of incredible pressure. And then I think what's really fascinating is, and Scott will talk a lot about this, is sort of what we're seeing as it relates to the government. So we've seen an administration change. We've seen sort of in 25, we've seen, I think, a real acceleration of sort of like, in some ways, the market needs to clear, and we're going to let it clear. We're not going to try and fix it. I think if you go to the next page, April, the sort of the reality for most people who are sitting in this conversation is a real pullback. This is some Kaiser, KFF, and CMS data just put into a single chart. And basically it says, look, what's 25? 25 is the year of the pullback. We're seeing the number of Medicare Advantage plans come down. We're seeing the number of ACA QHP plans come down. Those are the blue lines and green lines. The red line being the managed Medicaid. That line is clearly not going up. It's sort of flattening. The little red box below there shows membership as a result of whether it's federal subsidies, state budgets, but this entire industry is sort of in a pullback. They are under real pressure for profitability. It is going to be it's a tough period, right? It's a big grand reset. And I think that sort of it's a moment. In many ways, it's funny. I'm an optimist at heart. Hard for you to believe, April and Scott. I know, who you know me well, but I'm an optimist at heart. I'm hope that sort of like some, in many ways, the worst is behind us, because we've sort of entered this period of restructuring, and so we have a chance now to think about the path forward. So that's why I think about 26 and the road ahead. One of the last picture I think we should speak to is sort of some of the trends around these networks. And this has been really interesting to me, which is, forever the conversation has been about bigger networks are better and broader is the best thing ever. As the margin pressures have expanded in 2024 and 2025, as the consolidation of provider ranks and sort of this challenge to get contracts. One of the epiphanies, I think the market's coming back to, and because you asked a question on networks, the implication of all this stuff on networks, is this shift to where bigger is not necessarily better. There's growing consensus and recognition that a network that is more effectively structured, so it doesn't need to be the biggest, but properly designed so that the primary care doctors and the specialists and the facilities are part of a kind of an efficient, care pathway. It is more effective for members, better care with less abrasion if the network is designed properly. So the word I like to think about is composed, the composition of the network, as opposed to simply put everybody in the network and trust that we can either steer members, which is a terrible word, or we can impact the practice of medicine and change the way doctors deliver care, which is another not that exciting approach to this problem. But really start to see that like better networks can lead to more efficiency and more member satisfaction. This is the Kaiser thing. I'll just explain the chart because it just came out recently. And it was a really, really great study. They looked at Medicare Advantage networks across the country, and they were looking at sort of how broad or narrow the networks are. And one of the charts buried in it was this one, which showed that the actual 5-star networks were effectively the narrowest in their market. And so what they were saying is like, look, you can build a bad narrow network. We know that. We see that all the time. But if you really want to have a high-performing network where the members feel like getting the care and the pathways of care work, narrow is where you want to go. And so this chart shows that the 5 stars are 43% of the providers in the market, and the 4 stars and 3.5 stars are in the 50s. So it was very interesting to say that there is a sort of narrow that's really smart. But this leads to this topic here, which is around data, right? Like, because doing this, as I've said, composition and building smart to hit the MLR, to hit the utilization, to hit the member experience, it's going to require a lot more data. And the data is more complicated now, and it's moving very fast, right? One of the things that we are struck by here at Quest as we work with all these constituents is sort of the recognition that networks are like provider networks and the whole U.S. care infrastructure is basically it's a composition of living organisms, right? It changes. Doctors retire. They decide to relocate. I don't want to be in Omaha anymore. I want to go to Chicago. We see groups restructuring for M&A. We see hospitals hit financial difficulties. I'm from Boston, so we've watched Steward Health unravel. Good way to put it. And so this network, the challenge of a high-performing network, it's not a single moment in time. It's something that has to be curated and thought of over time. Like 2% or 3% of the network is changing every month. So between the beginning of the year and the end of the year, like a third to half of the network, whether it's locations or doctors, it can change. And so this is a really challenging problem when it's so foundationally important to the ecosystem's health. That was probably a lot longer answer than you were expecting.
No, but I think it addresses the complexity, right? And it addresses the pressure that health plans are under, especially as they're heading into 2026. And as part of that, Scott, all of that complexity is there, but then you have on top of that the added pressure of the fact that the government is evolving the conversation and that data, in particular, data integrity is becoming imperative. Why is that? What is happening?
Well, there's a lot happening, and I think it's important, the context that Steve just set out. It's really important to remember everything that's going on, all the market forces, and at the same time, as you mentioned, April, there's increased and different regulation to navigate along the way. So we just talked about how networks are these living, breathing things, quite literally. They have a fast rate of change, yet there's this discussion about what can we do as a regulator, and I'm going to use an example here from the federal environment, to improve member experience with that dynamic data. So one of the things we saw this last year, definitely a year of change, was a strengthening of the CMS posture that said we're going to put some rules in place about how we provide information about providers in a network to consumers. And what they said is, and it's an interesting timeline, right? In August, CMS said, we're going to take data through the Sunfire Matrix platform, and we're going to load it into the Medicare Plan Finder. And that's the resource that prospective members will go to, and they're going to make a plan selection. That was in August. In September, the next month, CMS turned around and said, you know what we think we're going to need based on the quality of this data? We're going to need a special enrollment period. And what that means is that if someone relies upon that dynamic data that Steve was just talking about, and then comes to find out that the data was wrong, the provider wasn't in the network, or was not at the location that was reported in the network file, or wasn't the right specialist, there was some error in the data, you can actually disenroll and enroll through this special process in another plan. Fast forward to just October, right? So August, we're going to do that through Sunfire. September, we're going to let you out if there's a problem with the data. In October, the criticism started to rain down, right? You saw articles in the Washington Post had probably the best known article. You also had a little quieter effort raising awareness around the concern over data. You had Senators Merkley and Wyden. They got together, and these are the ranking members, right, of the Finance Committee, and they said, not so fast. What's going on with this data? The interesting thing there is that the CMS response was not, oh my goodness, the data's wrong, we need to retreat from this. It was, of course the data's wrong. We've known the data is wrong. That's why we put the special enrollment period in place proactively, which is rather extraordinary, right? It's admitting that there's going to be potential harm based on this data, but we're going to go forward anyway because it is that important to shine a light on the inaccuracies in the consumer-facing data, right? So imagine trying to navigate that. So you're trying to understand how your health plan actually looks to potential members in the Plan Finder tool. At the same time, your organization is navigating everything Steve just talked about.
It's a fascinating concept, Scott, because what they're basically saying is, look, we're gonna create the marketplace, but you have to demonstrate that, you know, your members that you are going to curate the content, that you're going to be the right partner for them.
Right.
It's not on us, the government. It's on you, the payer. It's on you, the provider.
Right. And if you go back in time, Steve, you think about this discussion about who's responsible for the accuracy of provider data. It's actually not a political issue or a partisan issue, right? It goes back across several administrations. You can go back to probably 2001 and start to see real strong references to, we have to fix this provider data. And what you're seeing is, through this most recent legislative posture, a doubling down that this is the problem of the health plans. We believe that the file submission through Sunfire is a statement to your members about what your network is, and we're going to hold you accountable to fixing that data, rather than criticizing the report of the data or the window to the data.
What's interesting though, and this is now, you know, Scott, you and I, we live in this sort of the cornerstone position. So we have payers, providers, regulators, all as clients of ours, and we work with all of them. there's a long sort of debate about who's responsible for the bad data, right? Is it payer? Is it provider? Is it like, and I think what at the moment the conversation says is yes, like yes, and in figuring out how to unlock this is, in the last 12 months or so, I think we've seen is more like the government saying, look, we're not going to be the ones with the secret key.
Right.
We're turning to you all to collectively help us and sort of find that path forward. We part of that national directory of pilot in Oklahoma. You're just seeing a bunch of like, we're going to try this.
Right. We're going to try different things. And you said something really important a second ago, Steve. You could debate who's responsible, right? I mean, there is all kinds of opportunity for the data to become inaccurate. What the federal government is saying is, regardless of who's responsible, health plans are accountable. That's what they're saying. That's the line they've drawn in the sand. Whether it's fair or not is a totally different discussion, but it does shine a very stark light on the importance of being sure that the data you're presenting in your provider directories through Sunfire into the plan finder is reflective of the network you're actually offering to your members, even though some of those details may not be under your control.
Right. And I just to make this sort of in a world of cost, where every dollar is scrutinized, and whether it's both MLR but also administrative. Like, remember, there's lots of different pools of investment on this data problem. I remember we were chatting with sort of a health plan executive about a year ago or 2 years ago, you and I, and one of the comments they said to us, they said, look, half of our customer service complaints are driven by directory data issues. Like, it's the number one source of sort of feedback and frustration. And if you start thinking about taking a call, how much does it cost to take a call? How much does it cost to follow up on the call and figure out like half of the complaints coming into that complaint line were tied to directory data. This data is at the root of, better value, which we've talked about, so the network design, but then also operational sort of efficiency and effectiveness. And these are just like other inside the MLR, in the admin, it's just like all data.
Right.
Well, and this is a way different conversation than it was back in 17, 18 when they were doing audits and basically fining health plans into submission, if we can say it that way, or trying to. And now they're saying your data is your data, but we're going to put it out into the world, right? And that's a way different conversation than it was before. And Scott, have you been seeing this, not backing down stance that the government has taken trickle down into the states at this point as well?
I think states are very interested in the position taken by the federal government in saying, you're right, at the end of the day, the consumer experience, the member experience is the most important measure of your network, right? Because that's what they're really accountable for on the state level. So yes, April, I think that you're seeing a similar posture, and it's an interesting time because this discussion about what can we do to improve the data, right? That's sort of the parallel conversation that this position unlocks. If the data itself is going to be presented to the world or just set free, if you will, right? Then you can have a real discussion about, well, what would it take to improve that data? And that's something that should be on the top of mind for everyone today, right? Because if you think about the world we're moving into or that we're in right now, there's so much application of things like AI against these large data models, right? And there's this sea of data that is going to be organized by technology. What we're realizing is that before we do that, we may want to be sure the data that we're organizing is clean enough to give us the insights we need to run our businesses, right? Or to meet the needs of the member. It's an interesting parallel conversation.
Well, and adding to the complexity, I hate to do it again, but I mean, how do you look at cleaning up that data when what's right can be very contextual as well. And I know we've had conversations about this, but you could have multiple scenarios where what's right here is wrong here. So how do you look at that? Steve, I see you shaking your head.
Yeah, we're laughing because we've had this conversation, which is the same physician, and can be they can be a pediatrician in one context. They could be an orthopedist or primary care in another context. And it's right. It's not. Is it Medicaid? Is it Medicaid? Is it a QHP? Like, what's the context? It is a and what's right is a fascinating conversation. Like, we have become everyone wants to talk about accuracy and perfection. Like, there's no such thing as data perfection. And the dimensions of the content that we're trying to manage are from the mundane to the very complicated, right? Like, so the mundane, like, is that actually what suite is this provider in? Like, are they on that street or not? Is this their direct line to their office? Is this the health system, operator number? To the more complex, which is this actually is they are an orthopedist, but they only do wrists, right? As opposed to the other one who does knees. So the richness of the content is very complex. Scott, you spend a lot of time. What's a ghost provider?
Right. The ghost provider is a provider who is included as part of your network offering, but there is no evidence they're actually seeing patients, right?
Right.
And to your point, Steve, that is also situational. What kind of patients, right? Am I not seeing Medicaid patients? Am I not seeing Medicare? Am I seeing only commercial? Am I seeing self-pay? And the profiling becomes really important, especially as we're seeing a regulatory stance where if there is not claims-based evidence of a provider seeing patients, then maybe they shouldn't count towards your provider access scoring, right? But we better be certain that we understand where that provider is being labeled active or inactive or a ghost, what line of business, for what kinds of patients, so that we're not sloppy in assigning the ghost provider, label to the wrong providers.
Right.
So it seems there's, just to reiterate, Scott, what you're talking about, it's a industry-wide demand for real-world accuracy, data integrity in your directory, and that where the government conversation has shifted a little bit is that the data they're concerned most about is that member-facing data.
Right. The data that the way you reflect your health plan to your members is your health plan. That's where I think we're headed.
There's data all over the place, right? There's data everywhere, but that's the one that the government's focusing on.
Yep.
Right. So I think it's worth sort of double clicking on that point a bit, because I think the government has come to this, not just the government, I think employers, I think home, like me, my family, like patients, providers, like there is this sort of recognition that the sort of the chain of the problem is long, right? There's a directory, then there's a care moment, and there's a claim, and there's an adjudication. Then you got to figure out the plan and the copays, and like it's a very extended, if you will, sort of experience. And what everybody is sort of recognizing is that we need to understand where we need to be honest to ourselves and sort of manage the differences in these different spots, and think and like come up with a point of view that, like, if a public servant, which is effectively what an agency, a regulator head is, they're a public servant. Their job is to protect the public, to help the population. And what they're trying to do is say, look, this is a very hard product to understand. You're making a choice based on this directory thing, and hopefully you're going to find a plan and a care community that can support you and your family. It could be your kids, like everyone else. It's very personal. That access point, that access community you're building, is what we need to make sure has some integrity to it, like the promise is with it. But at the same time, we know that from that access discussion, there's going to be a set of claims, and the network is going to change, and there's going to be out of network and out of network care, and there's going to be uncovered procedures and like all this stuff, and so the adjudication engine. And so there's a very, very challenging, and I think, Scott, I know many of your clients think about this sort of recognition or sort of thoughtfulness about how to deal with what is the directory and what is the transactional adjudication piece to this puzzle. And then separately, even what's the contracted and the network management and the design part of this puzzle. Three really interesting, somewhat related but independent problems.
Yeah, and Steve, I've been doing this much like yourself. We've been doing this for a long time, right? And I think in recent memory, the conversation would have been about explaining those different segments you were just talking about, right? Like let's have a meeting and talk about why this is so hard, right? Now, I think what's changing and it's energizing is there's sort of a democratization that's happening where if you have ideas about how to change this related directly to the posture that CMS has taken around Sunfire, we just talked that all the way through, right? Being rigid in this is your data, we're just showing it to the world. If you need it to be different, fix it, and at the next refresh, it'll be different, right? The opportunity to show how we can actually improve our data is, I think, more accessible than ever before. So there are these, and I think we have a slide on this. There's a gathering called Connectathon, and if you go to the CMS website, and if it's not, oh, here it is. Look at, there it is. The next slide, there it is. We are participating in this initiative around early adopters, and I'm sure that most of the folks on this call have heard the invitation went out far and wide, right? If you are in the ecosystem, in the tech ecosystem, you're an IT company, a provider, a health plan. If you have ideas about how we can improve the data ecosystem, the invitation is to participate. What's interesting is that it's Steve, it's a show me, not a tell me, right?
Right.
It's how would you actually fix it? There's not a lot of patience for explain to me why the data is broken, right? But there's an insatiable appetite for tell me how you might fix this, how you might improve it. And I would just urge anyone who's sitting here thinking, I would like an audience, right, to talk about some ideas that I have, some collaborations that I have. You can actually go on the CMS.gov page and you can register. You can say, yeah, you know what, I want to be a part of this. And the gatherings that they have roughly quarterly called Connectathons are the opportunity to work with your peers, talk directly with senior leadership at CMS about different ideas to improve the data ecosystem. And I think that's different than it was just a couple of years ago.
This makes me think about, as this conversation is changing, the opportunity with the special enrollment period now that's out there for that choice. Like if I picked a choice and it's not there anymore, I can change, which is huge. But if you bring this down to the human side of things, I was having a conversation with someone who had a very impactful, life-changing medical experience, and they said something that has resonated with me that brings this all home as to why this is so important. And the bottom line is we're building networks that ultimately we're going to need, or our loved ones are going to need, or someone we're caring about is going to need. So it's not just we're building networks for our members, we're building it for all of us. Like it's something we're all going to have to use at some point. And that's why it's imperative that it's accurate, right? I mean, that's kind of the universal thought here.
Or that it's accurate, or that it is in fact focused on our access and our experience. Like accuracy is sort of becomes an ongoing is requirement. Like we have to curate this content because this is the foundation by which we're all going to get care. This is it.
Personal. It's
Right?
personal.
Correct.
For everybody. Personal.
Right.
All right.
And of course,
so
is AI going to solve this?
Well, that's where we're going to head, right? Like if you attend any conference today, anywhere, and you go by every room with the board, here's all the sessions that's going to happen today. AI is in 95% of those, right? And so we'd be remiss if we didn't discuss technology and AI and the path forward here on the call today.
Right.
But I also know that the two of you have a pretty unique perspective on this, and I've said that before, but this is really where it shines through. And so, Steve, I'm going to start with you. What role does AI play in network strategy today? It's a broad question, but I know this is something you've thought a lot about.
So April, I'm just pleased to announce that now we're no longer Quest.com. We're now Quest.ai because we're joining the growing trend of every other company that wants to be a .ai. That is completely wrong. I'm joking. I've heard AI and agentic technology and the LLMs and all this stuff, the equivalent of when man invented fire, or more profoundly changing the world than the internet. And I'm probably, it probably will, right? I'm not smart enough. I don't have enough perspective to say that's wrong. But for me, as we keep, we think about AI here at Quest, and we think of it in multiple sort of perspectives, right? So one thing that we spend a lot of time thinking about is how do we want to use it in our own operation? And I use, our production of software, our processing of data, our role engaging with all these constituents. So how do we integrate internally? We think secondly about how we are using it as it relates to our solution, and so the environment and experience of our clients. So when they do pull up our software, obviously, like what does it look and feel like, and how is it AI powered? And then ultimately, the third piece to it is sort of our clients who are themselves integrating AI and sort of all this technology. How are we going to fit inside of their environment, right? Because they're going to want to do things faster and reduce autofill on our population. All of those are like really, really interesting. And I keep coming back to sort of these 2 or 3 different pieces to this, which is, one is sort of remembering sort of what are you trying to accomplish and how are we thinking, what's the objective function? And then that's separate from okay, so if that's what we're trying to accomplish, all this stuff's only as good as the data it's built on. So do we have the right data? And is the right information there? I've been doing predictive analytics now a lot longer than I like to admit. I'm coming up on 20 years in this space. And I always have I remind people that I can build the perfect predictive model. I mean, I'll never be wrong. I can predict exactly when the sun will come up tomorrow. Right? I'll never be wrong. The question becomes, does it add any value? Is it innovative today? Does it change anything? Does it help? I'm right, it's perfect, but how did it help? And so when I think about this AI context, it's incredibly powerful. Yeah. To what end? And on what content, and how are we going to make sure it works that way? And we have some conversation with it. Scott, I know you spent some time talking about this in the government context as well.
Absolutely, and I'd add another category, Steve, to you're talking about the different groups and how they may leverage AI. One thing that AI is really good at, and it does it with no emotion whatsoever, right, is looking at these huge data sets and drawing your attention to where there is an anomaly, right? Where's something that you should look at more closely? Right. And whether or not the data is right, it's going to show you where the data that it is available, right, is telling you to look. And that's something you should think about. Think about Sunfire, for example, right? Going back to that. How many provider records are sitting in Sunfire And what would it look like if you were to apply an AI engine to that database and imagine the questions that would result about the inconsistencies in the data? And to think that that isn't happening would probably be naive, right? So we need to think about the applications of AI in the context of not only what problem are you trying to solve, and do you have the data that you need to solve that problem before you unleash AI on it, and also the data that does exist, what will that look like under an AI analysis? What do you think it would look like? And is there an opportunity to improve that outcome? Those are a couple of things I think about in this space.
Right. And interesting, Scott. So, April, I'm going to push the conversation forward. So we've talked about objectives. We've talked about the data. I think what's really, ultimately, I, who knows where this goes in 2 decades, right? I'm not smart enough to tell you that answer. But if I think about short term, the power here is that the technology can really accelerate insight to people that are really kind of expert and specialist, right? So I keep thinking about like where the judgment, there's a lot of judgment in everything we do in life. Understanding, like taking a phone call from a member and dealing with their emotions, there's a judgment in that. Thinking about, a network design, there are 2 different, cardiac groups that you're looking at. Which one do you want to kind of contract with and why? There is a judgment, there's an expertise in that. What is really interesting about the very early ability of AI is about sort of getting these choice points. Mm-hmm. Getting this content in order to make that judgment call to the expert faster. And so we can shorten the time between sort of a decision and the insight to make the decision. And we can sort of, I think someone internally talks about democratizing the insight. Like it's no longer has to go through multiple handoffs to get, someone has to know how to log into the system and serve it up and figure out the choice and package it up and send it. The system's able to say, look, here is the gap and here is the options and which of these, choices do you want to make? And so I think from a really early application, it's this question around sort of what are you trying to solve to and where is that expertise to make those choices? And AI can be really powerful to sort of push, move those decisions faster, reduce some of the handoffs. And everyone will like the less data, less the manual data gathering and fewer re-entries, but it's going to be a little scary for a while, right?
Yeah, it's a couple thoughts to pull on there, Steve. So, the idea that AI is moving so fast, right? We're already, it's moving so fast and evolving on every day. And so there's this pressure to adopt, start working it, start using it, adopt it today across everything. But I think there's a cautionary tale with that. And I think what I hear you saying when you say these choice points is you need to really focus in on where's your weakest point first, or where's your biggest struggle, and tackle things one thing at a time. Don't adopt across all. Is that what I'm hearing?
Exactly. It's easy to try everything and get nothing done. It's impossible to stay on top of the applications and the technology. Like we're looking at some agentic sort of calling technology, ability to kind of engage with a computer. We all have it. We hate it at the airline. Hi, do you want to talk? What are you calling about, and everything else. So we're trying to figure out. We hate it, but there is something in it that's interesting, and how do we use it? And we've reached out with sort of a vendor, and we're starting to talk with them. And by the time that we kind of do by the time we've done sort of the fact finding and we get to a point where we're talking about how we'd work together, we know that the vendor we're talking to may not be best in class anymore. Right? In 8 weeks, the market moves so fast, and so we are coming to this view that in many cases you don't have to have the most front edge exciting piece. It's more about like, what's the process, what's the thing we're trying to move, how do we focus on the data, make sure the data is in the right spot, pick something which is valuable but maybe not like, if it goes awry, it's gonna cause the whole system to collapse. But you gotta, again, our experience and what we're seeing with our clients and internally is pick something and that has real value and create momentum and confidence, because that confidence leads to organizational sort of creativity, and it leads to openness to change, which is really,
So it sounds
really,
like,
really important.
yeah, so go slow to go fast. Because if you go
Go slow
fast
to
too
go
fast, you're going to slow yourself down. And Scott, to bring this back to the data integrity imperative, I mean, the whole idea that AI can aggregate all this data and present it, analysis, recommendations, all of these things to the human element, the expert, as Steve was saying, to make those choice strategic decisions. But if the foundational data, if the integrity of the data is wrong, then won't the recommendations come out wrong as well? And
at the very least, they'd be incomplete, right? So, and I think that you mentioned cautionary tale. It's important to consider this part of the discussion in the context of the earlier discussion about the posture of the regulatory community, right? What we have seen is that the decision to present certain network data through the plan finder was challenged, right? And the regulator stayed. And the application of AI is likely coming, right? It's on us to think about the data that technology is applied to, and because it's going to be applied. And we're either going to find ourselves explaining why, to your point, April, why something isn't correct based on the underlying data, or we can invest some time up front fixing the underlying data to the best of our ability, finding opportunities to demonstrate those successes, create momentum that Steve's talking about, and get in front of this a little bit rather than respond to it. It's important to understand that the problems that are trying to be solved with this new technology are enduring problems. The technology is right, but the problems aren't.
Something you said earlier, Scott, as we were thinking about this on the way in, and it sort of brings it to our 2 perspectives together, which is this hot spotting, like where's it red, and then sort of bringing the experts to the red, if you will. So don't worry about being perfect. If you can get rid of a big chunk of the problem,
right.
Okay, I'm going to have one more question for you before I turn it over to our audience, because we do have a couple questions that have come in from them. And it's kind of okay, so now what, right? If you're someone on this call, or if you're an executive, strategically deciding what those business objectives are for the near and long-term future, I'll start with you, Scott. What's going to differentiate a high-performing network?
I think from my perspective, the high-performing network is the network that performs the same for the members. The data is the same for the members as is submitted to the regulator, as appears in the provider directory, and understanding that the presentation of your health plan is consistent across all those different areas. That's what I think, to me, that's where I think we're trying to go, and that would be a high-performing network.
I think in a high performing network, I agree with what you said, Scott, but I think you have to understand the composition of the providers as it relates to the population that they're trying to serve. So a network that has data integrity that you can rely on in terms of the content gives us a foundation upon which we can start thinking about the business challenge. Do I have the right mix of care experts given this population, right? If I'm in a community that if my membership has a certain distribution of care needs, is the network data actually correct, but now it has to be designed to that, right? So access points, do I have sufficient home health? If I have an area with real bad transportation, and like, do I have the ability for transport, like for at home care, or the mix, or access points, right? So you and I would agree that it's data, and then that data has to sort of be in these dimensions that impact outcomes.
Right. Right.
Excellent. I'm going to move to questions. Scott, we were talking about earlier in our conversation about that human element, that it's personal. We all kind of depend on the networks and the care that we receive. I think this really resonates with that. Someone wrote in that recently they heard a growth officer from a health plan was asked what innovation will most impact health plans in 2026. Pretty broad question, kind of what we talked about early on in this call. And that growth officer responded apparently that they believe that the most impactful innovation is trust. And says for decades, payers and delivery systems have been positioned against each other, creating data silos, which we've talked about, we know, friction and costly administration processes that leave patients caught in the middle. Do you agree? And what innovations do you believe will break down these silos, increase transparency, and build stronger partnerships? It's a very long question, but I like the trust part of it. Like, that trust is the greatest innovation. What's your response to that?
Well, first of all, it's a fantastic question, right? And observation. I do think that trust is the core of healthcare, right? It must be. And when we think about the conversation we've had for the last hour or so, when we talk about the breaks in data, the failures of the system, all of that erodes trust, right? When I select my plan based on a provider that I need to see, and I find out the provider isn't available to me, that erodes trust. I'm intrigued by the question about innovation, and actually positioning trust as innovation is a pretty neat idea. I think the category of innovation that can help this is anything around aligned incentives, right? The understanding that it's going to become very tempting, especially as there's more scrutiny around the data. We talked earlier about, regardless of whose fault it is, the accountability is being assigned to the health plan. And having run a health plan, I can tell you how easy it is to point fingers at everybody else. Like, I'm on the hook for this, but I can't get this group to provide me change information. I can't, whatever it might be, right? There's a lot of very real reasons that this is hard. The category of innovation that will build the trust is an aligned incentive that you realize what we're all working for is member experience, and remembering that the member, the patient, the consumer are all the same person, right? It's the same person. And if you can keep that person in the center of your relationships, I think that's the best chance to foster trust.
Steve, we have time for one last question with a minute and a half type answer, but I wanted to fit it in. As health plans, you talked a little bit about this earlier, you showed the KFF study about the narrower networks. I think this is in reference to that, but as health plans consider moving toward narrower, more targeted networks, what factors should executives weigh to ensure these networks remain high performing and compliant?
It's a great question. So how do you make a high performing narrow network, right? Like that's what this is really saying. Like, how do you do this? So the first thing I'm always reminded of is narrow doesn't mean narrow everywhere. Narrow just means it's less broad. And so narrow could be, I've got a wide kind of portfolio of primary care PCPs, but what I've done is I've looked carefully at some of the higher cost, more intensive procedures that backstop those primary relationships, and I've narrowed whether it's the health systems to which are in network, or some of the specialists and some of the higher cost things, like to higher value groups, right? so that I'm broad in spots, I'm more targeted in other spots. Now, if you try to balance this, the trick becomes referral flows, and do the primary care folks sort of would manage relationships, have relationships with the people that backstop them, or do you have leakage or referral issues? And so it's the design of that broad and narrow. Like, do I have the right mix of ASCs against ambulatory surgery? So I can have ambulatory, volume at the right mix. So what we're seeing, April, is that this is a conversation. This requires sort of a very good, detailed view of the market, sort of the delivery infrastructure in the market. Like, who is delivering care in this market? And then being able to put them into, a lot of our clients and folks talking about sort of these groups, whether it's like, what's the membership? Like, how do all these doctors and care sites fit together? So what are my contract units? Like playing Tetris, so like putting these blocks together. And that you have to design in the market. And I wish I could say that there's one clear model that works in, Omaha and in Atlanta. It's not how, so it's a very localized market conversation about what's available in that market, and sort of how are you going to think about designing narrow in the right spot, broad in the right spot against the membership, those patients that Scott talked about, so that they can get care efficiently. It's a data challenge.
Yeah. And as we wrap up, I think we've kind of danced around this a little bit, but if you are going to be an AI evangelist, you got to be a data evangelist, right? I mean, that's where it starts. And hopefully we've helped everyone a little bit understand where those trends are heading, what impact that's going to have on the strategic decisions, the leader decisions that are going to be made here in the short and long-term future. And not to forget about that human element, right? It's not just about the AI adoption. It's about getting it to the expert, the human that can make those decisions. And that's across the organization. I mean, we're talking call centers, client services, customer support, like all of those interactions matter for that member experience as well. And that the government conversation is evolving and changing, and they are totally focused on that member experience and that member data.
AI can most certainly design a great network, but it takes experts to figure out if that network's really going to work.
Agreed. All right, as you just heard Steve and Scott talk about, as we look at the market and regulatory trends as we head into 2026 and beyond, there is a regulatory focus on consumer-facing data, and that the context of that data matters. We also had a conversation, everyone talks about AI. AI is the solution to all things. But what you heard here today is that AI is only one component of that solution. It's a way to aggregate that data faster, more efficiently, but then get it in the hands of the experts who can actually make those strategic decisions. Once again, thanks for tuning in to the Totally Adequate podcast. We know you have a lot of choices when it comes to the podcasts you listen to, and we're glad you chose to spend time with us. As always, please take a moment, provide us some feedback. We love to hear it. We use it to make the Totally Adequate podcast better. Also, let us know, give us feedback on any other conversations you'd like us to hold this year. Thank you again for listening.
Thank you for tuning in to this episode of the Totally Adequate podcast. If you enjoyed it, we'd appreciate it if you could rate us on Spotify or leave a review on your preferred podcast platform. Your feedback helps us grow and bring you even better content. We also invite you to send us any comments or topic ideas by emailing us at thetotallyadequatepodcast@questanalytics.com. The Totally Adequate podcast is produced by Fowler House Films and Quest Analytics. Thank you for listening.